Hello. We are now going to go over the cardiovascular medications. And as always, you want to know the objectives and the key terms. And with that being said, we're going to uh, recap the anatomy and physiology of the actual heart. You know, the heart has four chambers, continuously contracting and relaxing, coordinated rhythm, left and right atrium, and the left and right ventricles. Two major roles of the cardiovascular system is to deliver such oxygen, hormones, immune, and clotting factors to every part of the body, including the heart. Carry waste products, CO2, out of the cells. If any part of the system is damaged, the health effects can be devastating. We will cover the heart attack, stroke, clots, resultant damage. Chest pain can be a symptom, anoxia or hypoxia. Actually, the lack of reduction of oxygen prevents the tissues of the heart to be receiving enough nourishment, leading to both ischemia and infarction, which could be death. Now, one sign actually of a myocardial infarction is um, feeling that heavy pressure on the chest. And what you would do immediately is provide nitroglycerin, sub-Q, scheduled PRN as a protocol in the hospital setting and as ordered per physician. And then you're dealing with, because the chest pain is basically um, showing there's a lack of oxygen going into the heart. And it could be angina, but then it could be MI. So either way, you would treat it the same. Of course, you know, doing the blood pressure, all that, that would be not the first line of defense. You would want to make sure, um, of course, that's going to be done. But especially in like fast track or when they're evaluating before you get into the ER, they would have already evaluated the blood pressure. And then going back, it's a protocol for chest pain. And so they would initiate nitroglycerin, whether it was a high blood pressure causing it, whether it was an angina issue that some people have that actually is not a heart attack, but it could secondarily lead to one. Also, along with the chest pain, you're going to have the sweating, pale skin, and the cyanosis, the bluish, especially around the mouth. So, women tend to have the atypical symptoms, which is the angina issue. But then again, if they have um, symptoms such as upper back and shoulder pain, if they're rubbing their arm, or left arm especially, and the shoulder, that may be symptoms of an MI. And then there is lightheadedness, unusual fatigue that lasts for days, and that can different things that are typical for an older woman can make it difficult to diagnose um, right off the bat. But just remember, if you see a woman rubbing the shoulder and everything, that would be indicative of a heart attack. Brain, which is a CVA, being deprived of oxygen, blood flow for several minutes, caused by ischemia of the brain, which could be an embolus. Um, thrombolytic stroke, which is not a hemorrhagic stroke. It's ischemia, not hemo. Will receive blood thinners to prevent another CVA. Okay, we're going to go on and move on. I'm doing some pertinent information, especially since this we've had technical issues. So I'm going into the anginal medications. So anginal pectoris is a feeling of pressure on the chest. So you also receive nitroglycerin sub-Q if it's not a routine medication, or sometimes they will give it a sublingual. But in this situation I'm talking about, it's important to know to provide nitroglycerin sub-Q. Chest pain caused by lack of oxygen is reaching the heart. If the chest pain continues and the blood pressure is like 155/72, deliver the second dose of nitroglycerin. And then sometimes the nitroglycerin spray will bring it down, the blood pressure, quickly. So you have nitroglycerin buccal, spray, sublingual, IV, but the sublingual is usually most common. If you can read the PowerPoints on strategies to help treat angina and coagulation therapy medications. I'll go into stating that coumadin, if you use it long term, you would indicate a regular lab draw for PT and INR. And now preventing the clot formation by interrupting production of cofactors that can help in the clotting process. Now, heparin and enoxaparin given as subcutaneous injection, usually patients at the risk for developing a DVT, that will help prevent, but they need to get up and exercise and move. But just remember, Elovnox is one of these examples of the enoxaparin. They are ordered temporarily after surgeries to prevent a blood clot. And they deliver them in the stomach, abdomen, at least 2 inches away from the umbilicus. Avoid anticoagulant, avoiding profuse bleeding with anticoagulants. Use your common sense. The use of razors, they tend to bleed more. Reduce the foods high in vitamin K. And, by doing that, you're responsible and to teach to avoid any leafy green veggies and stick with the meat and potatoes. Some men would love that. All right. Now we got the antiplatelet medication, which is different from the heparin and Lovnox, which this is actually helps it's often prescribed after an MI or stroke to prevent the platelets sticking together. So just remember that's important after MI. And then thrombolytic medicines. You want to know plasminogen activator, the TPA. When you administer that, they administer that in ER. They need to know the onset of the symptoms. It's so important because you need to be used. The TPA needs to be used within 60 seconds of the CVA. So, skipping the antifibrolytic medications, we want to go on to the hematopoietic stimulant medications. Say, for instance, you want to stimulate those blood cells because you're having low iron levels. Patients are in chemotherapy. A big good example is the one most commonly used, which is the ferrous sulfate. And you have it to if it causes symptoms, because you need to drink it with orange juice or an acidic drink between meals, not with meals, may cause the gastric irritation. Well, you need to advise the patient to continue to take it because there's important need for that. Sometimes, though, when there's a genetic problem and they have the cyanocobalamin, which is, of course, B12, that is needed because they have a Mediterranean genetic disorder, which is pernicious anemia. And the person that's in chemo will have the Neutrogen, and it helps stimulate the white blood cell development. Remember all those things. And then we're skipping on over to angiotensin converting enzyme, ACE inhibitors. We have these medications. They stop the enzyme from converting the angiotensin 1 to angiotensin 2. And so this stops the constriction of blood vessels. So it stops that sympathetic breakdown or sympathetic response. So by reversing that, the Lotensin is actually a blood pressure medication, and it's going to have a side effect of lowering your blood pressure really quick. And you're on prescribed that medication for the first 2 weeks until until it levels out. If someone says, oh, my husband is feeling like the blood pressure is going down, you need to go ahead and call the ambulance right away. And like with ACE inhibitors, it may cause the hypostatic blood pressure, so avoid getting up too rapidly or changing positions. Now going on to the adrenaline and the beta adrenaline blockers, and then the calcium channel blockers. They help dilate the vessels so they can treat angina and certain tachyarrhythmias. But remember, they can actually cause edema, which is a side effect. That potassium sparing diuretics, we're going to skip over to that. And you want to know, like lactone, it is a potassium sparing diuretic. It actually is some of the first line of defense with, so anytime they start blood pressure medicines, you want to see that as a side effect. So the loop diuretics, loop thiazide diuretic, loss of valuable potassium. So they are non-sparing, potassium sparing. I'm going to state, and I already have talked about the calcium channel blockers. Just remember about it dilates and it decreases vascular resistance. And they treat angina and some tachyarrhythmias, but they may cause that peripheral edema. The cardioglycosides help treat help the heart beat stronger and more efficiently. Okay, that actually deals with like digitoxin. It will impact the contractibility, allowing the heart to beat slower and stronger. Remember that you always have to take the blood every 3 months, and you make sure you check the pulse before you give any cardiac glycosides and any beta blockers, because if it's below 60, you do not give that medication. But you also want to always check blood pressure, of course. And we're going to go past the dysrhythmias. We have the sodium channel blockers. They slow the electricity of the conduction. And then now with beta blockers, they affect the electrical impulse in the heart. So say to Norman, it slows the heart to ensure it increases the production of blood flow from the heart, but it does not play a part in hyperlipidemia. If a patient forgets to take their daily dose of Norman, say for instance, if it's a daily dose, yes, you will tell them to take it, because it is a daily dose, and it's very important they use it because it helps strengthen and reducing the under the electricity and conduction of the heart. And then say Zabeta, when administering the beta blockers, always check the pulse. Now, these people that come in the shock, you're wanting to make sure you're targeting that underlying cause. Whether it is hyperglycemia or respiratory dysfunction, it all may lead to either metabolic, acidotic, different types of shock. So always target the underlying cause. Of course, the effects of shock: metabolism slows, urine output decreases, blood pressure lowers, all these factors that here showed on the PowerPoint. But you have to understand, if you do not get it in time, it is very hard to get it back to where it's functioning. So they're going to give it atropine to help increase that heart, the blood pressure, so they can possibly do dialysis. But they're not going to have success if they've gone too long. Okay, lipid disorders. Of course, hyperlipidemia, high density lipids are the happy. They show they're elevated. They help route out the blood vessels. That's usually increased with exercise. And then the low density lipids, which are the LDL, the lousy, is deposits of fat in the vessels. So avoid those type of foods. Really important to have that type of education with the patient, and do a nutrition consult if you have a nutritionist or a dietitian in the hospital. And those are stated, the types of statin drugs. And then you have the fibric acid derivatives also that helps lower the triglyceride level. And those are stated here on the PowerPoint. So know the things, and the things I've stressed. It's really important, y'all, to get that and be successful in your test. So have a good afternoon. Thank you.